Welcome, Jonathan.
Thank you, Chair. That's very kind.
I also want to welcome Rhiannon Beckett as our Interim Finance Director. No pressure, Rhiannon.
Thank you, Chair.
And I also want to congratulate Julie and welcome her as our Substantive Director of Workforce and our Deputy Chief Exec. We've got some visitors. I'll call them Lisas, right? Because that probably covers it, but we'll introduce them in a moment. And I note we've got Charlotte here as well, and Gail. You're very welcome. Today's agenda, I've got apologies for absence pro tem from Alex. She will be joining us a little later. I have received Jonathan's declarations of interest and they are properly registered. Is that right, David?
That's correct. Thank you.
Thank you. If looking at today's agenda, are there any interests that require declaration that are all not already on record and declared?
None have been received, Chair.
Excellent. Thank you very much. Well, in our title, Health, Education and Improvement Wales, is that improvement word. And we all know that it's been a very difficult time for health and care services, and in particular for our clinical colleagues in the NHS. So I'm very pleased to welcome Lisa Duffy and the other Lisa. I can't remember your. Oh, Lisa Bassett.
Lisa Bassett.
Who are going to present to us today an improvement story about infection prevention and control. So I'll hand over to you, Lisa Llywelyn, to guide us through this bit.
Okay, so bore da pawb, a hoffwn gyflwyno Lisa Duffy a Lisa Bassett sy'n ymuno â ni heddi I ati sort of cyflwyno rhaglen atal a rheoli heintiau. Good morning, everybody. I'd like to sort of introduce Lisa Duffy and Lisa Bassett, who works with us here in HEIW. And today they're actually going to share with us the programme for infection prevention and control, which has been such a significant, important aspect during the last 2 years, during the pandemic. It has been at the forefront of every clinician's responsibility, and dare I say the public responsibility too. So without further ado, what I'd like to do is hand over to Lisa and Lisa in order that they can share with you the incredible amount of work that they've done through this pandemic in order to sort of raise this issue. So Lisa and Lisa, I'll hand it over to you. Diolch yn fawr.
Hi, good morning everyone, and thank you for the opportunity to present to you today on some of the work myself and Lisa Duffy have been undertaking. Next slide, please. Infection prevention and control practice is essential for maintaining a safe environment and reducing the risk of spread of infection and infectious diseases. This has always been important, but COVID-19 has highlighted the impact of IP&C practice across society, health and social care. As part of the operational response to the COVID-19 pandemic, but also more broadly, the prevention and management of healthcare associated infections, a joint health and social care task and finish group was established to identify minimum education and training standards for IP&C practice. Subsequently, led by HEIW, a content delivery group was established to coordinate the development of a suite of education and training resources aligned to the standards to support service on a Once for Wales approach. Lisa has been leading the work as part of the strategic response, focusing on specialist IP&C workforce and education, which she'll be telling you more about later in the presentation. Next slide, please. During a time of unprecedented service pressures, and like many other programmes of work which were paused, through the commitment of the members of the task and finish groups, fortnightly breakfast meetings were well attended and progress has been made. In February 2021, HEIW, in partnership with Welsh Government and Social Care Wales, published the All Wales Infection Prevention and Control Training, Learning and Development Framework for Health, Social Care, Early Years and Childcare. A dedicated IPNC webpage has been developed within the HEIW website, and to support level 0 of the framework, a short animated video was developed to reinforce best practice. The content delivery group have reviewed current NHS mandatory training and is developing refreshed content. These resources will be available in March. Also, in line with framework level 3, a supplementary educational resource in the form of a MOOC has been developed. The resource has been piloted and an evaluation undertaken. Next slide, please. The All Wales framework sets out the standards that should be used to inform practice to help reduce infection rates across the health and social care system. The framework specifies different levels of training, learning and development. These are represented as level 0, improving awareness, to level 4, the specialist knowledge and understanding, which Lisa has taken forward within her programme of work. Next slide, please. The review found engagement of colleagues were, review found colleagues were often unsure where they could access IPNC resources and training. In response, a dedicated web page has been developed within the HEIW website. The functional page is both a central repository for new resources which have been and are being developed, but will also include signposting to other resources which are available. Since the website was launched in March last year, both myself and Lisa received inquiries on a regular basis. Next slide, please. As part of this work, a short animated video, which is available in both English and Welsh, has been developed to reinforce best practice and behaviours of both staff and visitors to care settings. Fiona, can you play the animation, please?
Unless you've been living under a rock, hiding in caves or deep in a sock, you'll have heard about germs on your hands in the air and know these are things that we don't want to share. Let's stop them spreading. You know what to do to stop COVID and colds, norovirus and flu. We'll all be much safer when standards stay high, and through your commitment, fewer people will die. Washing your hands is the #1 ask. PPE when it's needed, same with a mask. Bare below elbows, clean that surface and floor. Together we're fighting the pathogen war. If you're a visitor, the rules apply still. Don't come and see us if you're feeling ill. Whatever your symptoms, bad tummy or head, to keep others safe, come next week instead. Whenever you stop a likely infection, I'm sure you're aware of the obvious connection with antibiotics and work to reduce the global disaster of their overuse. We're in this together. We all have a role. Follow the rules and help reach our goal. Work hard to reduce the bugs that we share, preventing infections and showing we care.
Thanks, Fiona. The resource which, with the support from our comms team, has been shared with stakeholders for use locally, for example, health board intranet sites and visual display screens in waiting areas. Next slide, please. The review of the educational resources found the NHS mandatory training was both out of date, repetitive, and often didn't change an individual's IP&C practice. Content Delivery Group, with support from Swansea University, have refreshed the content and updated mandatory training modules will be rolled out in March. The new modules are not only more engaging, more relevant, but also reinforces that each one of us has a responsibility to prevent the spread of infection. Alongside these, the mandatory training for health, new resources which didn't previously exist have been developed for the social care sector. These two will be available in March. Next slide, please. The review of current education resources also found a lack of focus on behavioural change and leadership for those operating at a more senior level. In collaboration with Bangor University, an online course in the form of a MOOC was developed. The 8-week course focuses on promoting infection prevention control principles and practice, but also behaviour change, championing and leadership. Pilots of the MOOC programme took place in July and September, with 170 individuals being enrolled. Feedback has been overwhelmingly positive on completion of the programme, and completion of the programme has an impact on changing practice for all participants, improving both confidence and competence to do the job. More importantly, participants reported a better understanding of their role as a manager, quality improver and change agent within their own working environment, which could be used for many aspects of a manager's role, not just specific to IP&C. Lisa will now update you on some of her work.
Diolch, Lisa. So I'm Lisa Duffy and I'm the Programme Manager for the Infection Prevention and Control Programme that is focusing on our specialist workforce. So my role as Programme Manager commenced in May 2021. So my substantive post, I'm a Senior Lecturer in Swansea University, and prior to that, for 18 years, I was a Senior Nurse within the Infection Prevention and Control team within one of our local health boards. So my programme of work is fast-paced. Started in May and it's for 12 months. So there's a lot to develop during that period of time. And like Chair kindly mentioned in the beginning about the current challenges within the pandemic, this programme of work has been developed during this difficult time. So our specialist workforce, their role has been acknowledged during the pandemic and it's given an opportunity to reflect and look at transforming and improving this workforce. So there are two main objectives that lead from this programme, and it's to review the current skill mix, recognise the contribution that they make, but also look at transforming and make it more resilient, look at succession planning, and also look at the importance of their specialist education as well, developing their knowledge, their competency to be more resilient for the future. So the background, when I started in May, within the first 2 months then, there were questionnaires that were sent out in relation to the current skill mix of this specialist workforce. So data came back that helped to inform the work of our task and finish work groups. In addition, an educational questionnaire was sent out, and that provided information in relation to what education has been previously accessed by the specialist team, but also additional ways that education, training and development can be achieved in the workplace as well, and give opportunities to work with our universities, to work with other organisations and work together to enhance the education and development of this very important workforce. So I do apologise for the next slide. The illustration on the left-hand side is very small, and this is going to be enhanced with our digital team. So it's only a very draft infographic at the moment, but it is going to become interactive. So 2 task and finish groups have been set up. They've been meeting since September, and they've really embraced the need to transform their workforce and their education. So although they've been extremely busy in practice, they've taken the time to meet, to work together in an all-Wales approach to look at developing the workforce. So now you're seeing on the left-hand side the interactive workforce model that we're hoping to develop. So you can see that within the lilac and the grey is the core infection prevention and control workforce. So it is made up of lots of different professions, clinical and non-clinical, and this workforce model has been enhanced by embedding best practice, evidence-based practice, and also from reflection of the pandemic, what additional roles have been brought in within this team during this period. So what it really captures as well is how this workforce has to move forward and be transformed in order to meet the challenges of potential future pandemics and antimicrobial resistance as well. So within the grey boxes, you can see that there are two stems coming from underneath them. One of them is looking at the operational role of the infection prevention and control workforce. So making a divide between operational and informatics really does capture the need to look at bringing additional professions, practitioners into the workforce, scientists, analysts, surveillance, etc. So with the operational route, having additional support with surveillance will allow our practitioners to be at the point of care, to be doing infection prevention and control rounding, assurance checks, being where the care is delivered, supporting our colleagues on the front line. Having an informatics team will help to support the need for digital intelligence, analytics, surveillance. So the huge developments, and these are the ideas of our colleagues, our IPC experts. We've had support from professional bodies, and it's multi-professional as well that have been involved in developing this workforce model. For it to be interactive, it's going to be layered. So the idea is that you will click on a role and then you'll have layered information, and this is very draft. That's why it's in small text so that you can't read it, because it's nowhere near the final version. And it will give the core functions of that role within that workforce model. I want to include as well that part of this workforce has allowed us to consider the community, primary care. Sorry, I've gone too fast now. Primary care, care homes, to ensure that they are considered in this new workforce model. So like I said, it will link to more layered information in relation to the core functions, and also as well as the core functions, it will link to another piece of work which has been developed by another task and finish work group that are looking at the specialist education, learning and development of this workforce. So it will signpost to what specialist IPC education is available at the moment, but also will link to core competencies for this team. So each role will link to a set of 4 core competencies, which will highlight areas that the IP specialist can develop themselves, and it will help for the managers of teams as well to support the development of these individuals. So it is a continuum of the work that Lisa Bassett has done. So the development framework is in the same format, but it addresses the need to develop level 4 to level 8, and it aligns to frameworks that are available and competencies in relation to the different professionals within the team as well. So outside the core workforce, you can see you've got the pale green and you've got the blue, and that will give us almost the ability to develop an infographic of where you've got the core IPC team, and then you've got, it's almost like the hub and spoke arrangement. So it'll help to align and to map to the additional services and facilities that are linked into this workforce model. So I think I've demonstrated how it's committed to improvement. And this work is aligned to key strategic documents and strategies. not only within HEIW, but also within Welsh Government. Latest Welsh Government Health Circular in relation to antimicrobial resistance and healthcare-associated infection improvement goals are linked to this programme of work and are being addressed. So it's about this specialist IPC education, about workforce specialist competencies at an advanced level, but also acknowledging that there's the need, obviously, to think about additional staff within the workforce and also to support their education as well. So having these resources is developing a career pathway. It will attract more people into joining the infection prevention and control workforce. So we're looking at succession planning as well. From the questionnaire that was sent out, we have now got evidence to show that predominantly the infection control workforce is comprises of nurses, and they are coming up to retirement age. So looking at opportunities to enhance that workforce. So we've got succession planning and also bringing in that core function, the roles, the competencies, is going to improve infection control practice and moving it more into the area of care to be invisible at ward level. So it's an all Wales approach. All the health boards have been involved. There's joint working relationships, and they're committed to making improvements. And they feel that infection prevention and control is important, and their role is important through developing this model and the education. So we'll have a specialist workforce that are more resilient and more competent to deliver the infection prevention and control programme. So diolch yn fawr, thank you for listening. And Lisa, Bassett and myself welcome any questions.
Thank you both. I think that's absolutely amazing and just demonstrates the importance of all the work that you're doing is underpinning actually the improvement of the health of the people of Wales. So Chris, I'll hand back to you. I hope that had impact.
Well, I loved the video.
Told you.
Yeah, and the rap to go with it. So well done for that. But importantly, I mean, nosocomial infection and antibiotic resistance are probably going to be major issues going forward, and which will affect every practitioner and everybody involved in health and care. So I think this is a really important piece of work. I know that there would be a lot of questions on this, and I'm gonna have to move us on to the rest of our meeting, right? But I think what you've given us today is a fantastic snapshot, right? Well done to you all, and I really want to perhaps get our independent members invited perhaps to the launch of the work in March as it goes along. So we look forward to hearing how it goes, and most importantly, what impact it has. Right? You setting all this up is fantastic. I think we need to see what impact it has to make sure it gets traction. So well done, and thank you very much indeed.
Thank you.
Diolch, Lisa.
Okay. So thanks for bringing that, Lisa.
It's such an important issue, significant.
So now we need to move on to the main body of our meeting now, and I'm going to go to the draft minutes, please, of the board meeting that was held in November 2021. It seems so long ago. So can I just go, please, for accuracy, page 1, page 2, 3, 4, 5, 6, 7, 8. Rhiannon,
Sorry, yeah, so on page 8, the PSPP, Public Sector Payment Policy percentage figures, the target is by number, and I think they are by value. So non-NHS should be 96.91, NHS should be 87.67.
David, can we pick that up and amend, please?
Yes, thank you.
Thanks, Rhiannon. Page 9, page 10, page 11. Are members content that that record's accurate?
Yes.
Thank you. I'm now going to the action log. This is, as far as I can see,
Yes.
verbal update today on the one agenda item there.
Diolch, Cadeirydd. Yes, there's an update on action log 2511/3.3, which is to do with the reporting requirements around the duty of quality. So just to confirm, the duty of quality requirements will come into effect on April in 2023, and consequently the first formal reporting period will be for the financial year 2023 to 2024.
So we have a year in preparation for that.
That's correct.
Okay, Jill?
Yes, sorry, Chair. David, sorry, I may have missed it. Have we had anything on the duty of quality?
Yes, we've had presentations previously, but we will obviously be preparing further presentations as we approach the April deadline.
Right. Is it called something more than just the duty of quality? Is it?
That's it. It's part of a broader act.
Yeah. Oh, that's okay. So social. Yeah. Okay. Thank you.
Hush.
I was just going to assist by saying that we did bring the National Quality Framework to board last year,
November.
which is in November time. So I think that's what this refers to.
Okay.
Thank you both. Thanks.
Right, so we're going to go back now to the minutes, please, because I can see the other actions are all completed. So going back to the minutes, are there any matters arising that are not on today's substantive agenda or not covered by that action log? So page, Jill, your hand is up. It's an old hand, is it? Yeah. Page 1, page 2, 3, 4, 5, 6, 7, 8, 9, 10, and 11. Are you content for me to sign these minutes off?
Yes.
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 Thank you very much. Now go on to my chair's report. I suppose where the most important thing to be saying is that we're in a moment in time where it looks as if we're transitioning from the tumult of the last 2 years, where we've been reacting to the coronavirus in various guises and having to take the most severe and difficult decisions. And this has had, as I've pointed out, this has had massive impacts on every individual. It's also had huge impacts on what we would see as planned and routine patient care. And it has been, as we all understand and appreciate, a very serious time. And that seriousness, we have to get through. And for some people, it's a very personal thing. But it's also been a very serious time for the workforce in the front line of health and social care. And it would be whilst we talk about education and training, and whilst we talk about innovation and improvement, I think we also have to remind ourselves that we all need a bit of healing. And I think we ought to reflect that that's not like flicking a switch. Now, part of the healing process for everybody, of course, is to have hope and to see what, to see how we deal with the future. So they are linked. I also want to say that we have led on compassionate leadership in this organization. And it's not fuzzy, it's not fluffy. It's very serious business. And this is the moment in time as we're transitioning that we have pick up all the lessons that we've needed to learn, but we also take the advantages of things that we've uncovered. So for instance, the digital agenda, the informatics, the importance of informatics, the leadership we've discovered, particularly clinical leadership, and also the partnerships that we've developed. I think this is a time where we put those on steroids, and today's agenda with our IMTP really does put us in that space. Over the last months, I have been joining the exec team, Alex and the exec team, in meeting with the health boards at board level and sharing what we're doing, listening to what their aspirations are, and it's been very well worthwhile. I've completed a process of chairing, interviewing for 2 new independent members. And today I'm very pleased to welcome Jonathan Morgan here as a new independent member. But there's also another end of that, and that's people finishing. So John, this is your last board meeting, and you finish as an independent member with us on Monday. And I would like to put on record our thanks for all your contributions throughout an extraordinary career in the Welsh NHS, but especially for the role you've played in this organisation from its inception and from being our vice chair. You have been an excellent ambassador and advocate throughout that time, and I'm sure we all wish you health and happiness and a grand retirement, John.
Thank you very much, Chris. Thank you.
Going forward. The other thing I would like to say is that the All Wales Chairs Group have in the last meeting had a proper discussion about succession planning and leadership. And I was able to provide them with an update. Thanks to the team and Julie in particular. But I was reminded of a target that everybody has signed up to, and I'll put it on record now that I look forward to us achieving that target, where the NHS in Wales is able to shortlist at least 3 people from the NHS in Wales at interview for every senior executive post in Wales by 2025. And I think that if we were able to get that far, that would be an amazing legacy. And it would transform, I think, leadership within Wales. It is not going to be done by bits of paper. It's going to be done by actually backing people. And I would say that it is really important that we all promote that drive. Finally, I don't know about you, but it's lovely meeting on Zoom and Teams. But actually, we do need to get back together in the same room. And I do hope the next few months we'll see our staff being able to safely and appropriately come back into Tydysgu with a new hybrid model of working, that said. But I think being together, working together, thinking together is really important. So I would like just to finish off by saying that this is going to be challenging. Don't expect the future to be plainer. There will be bumps and difficulties, but there's never been a time more important for the education and training of the workforce that we've got now and the workforce of the future. This is the time to invest and deliver on that work. And the staff at HEIW, I thank you for your dedication and your focus through these challenging times to ensure that we've maintained an eye on that ball. And through our IMTP, we will empower much of our strategies. So thank you very much. John's contribution is well demonstrated in his report. Two of the fundamental things that we aim to deliver, the primary care education training agenda and the mental health strategy, are all things that John has promulgated through his vice chair role. So thank you for that, John. I won't do any more. I'll just say that I don't expect any questions, but it's there to be thought about and pushed back on. So I'll now hand over to Julie, who will do the Chief Exec's report.
Thank you, Chairman, and lovely to see everybody today. Thank you also for the kind words of congratulation and welcome at the start of the meeting. As colleagues will know, I'm absolutely delighted to be staying with you for the future. So fantastic news. So yeah, I've got the pleasure today of delivering Alex's Chief Exec report. Obviously, it's there for a matter of public record. So you will have had the chance to see it and review it in advance. But I just wanted to highlight a couple of things, I suppose. So since the last time we met, we've all been dealing with Omicron. And obviously, there's been a huge amount of community transition around that particular variant, and that has added to the pressures on the NHS and also the level of demand across the system. Workforce has been a key concern, not only because of, they've already come through 18 months, 20 months of dealing with COVID, and a lot of staff are feeling exhausted and quite burnt out, but also actually, the spread and the scale at which Omicron moved through our communities meant high levels of absences, not only directly sickness related, but obviously those with caring responsibilities and or the need to self-isolate. So you'll have seen from the news, lots of concerns across the whole of the UK about absence rates. The latest situation we find ourselves in, I suppose, if you look at what's been said in the press and in the news, is cautious optimism, and the Welsh Government have laid out a route map for how we get to level 0. So in relation to HEIW itself, obviously we're continuing to support the national system efforts. We continue to look to see where we can add value and support our colleagues, and the IP&C presentation you had earlier is a demonstration of one of the areas where we're really active. In relation to our own staff, our absence levels have been quite small. We have had a handful of staff who've had COVID, but because of the home working and because they've been asymptomatic or not actually particularly very unwell, they've chosen to work through. So we've been in a very blessed situation as an organisation. What we did do was close the office completely for 2 weeks over Christmas while we looked at the Welsh Government legislation. And on the 10th of January, we reopened the building with very restricted and limited access. And we've just discussed yesterday in our executive team a route map for the next 6 weeks to get us to an agile blended working model. So we'll provide more information to that, to the board on that in the next couple of weeks. So that's the sort of COVID update really. I think the other things to highlight in Alex's report are that we had a really positive joint exec team review meeting in the mid-year since the last time we all met, which was good to have some external validation of the work that we've been doing and some support. We also had approval to our education and training plan, so I wanted to put that on the record. That's a huge amount of work for colleagues across the organisation, and it is where we get most of our money from. So the fact that we've got that approved pre-Christmas is a really significant event in our calendar. Obviously, we're starting to think now about next year's plans. So, you know, it's a continuous cycle and work and updates to board will be coming through on that. I think the only other thing then, because several of the items in the Chief Exec's report are on the agenda for today, including the Imtp and the finance report, but I just wanted to highlight the mental health workforce plan, which we've been developing with our partners, Social Care Wales, and through quite extensive engagement with our stakeholders. We're at the point now where we've got a consultation document with a set of actions, which will be released on the 1st of February for an 8-week consultation. And during that time, there'll be extensive workshops, meetings, social media. So we're going to be promoting that. And we would look to board members also to be pushing that around their networks. So we'll make sure that you get a copy of that when it's available on Tuesday, and also the associated social media, so you know the messaging that we're putting out. But that is a significant piece of work and one of the key deliverables from our IMTP. So again, you know, thanks to everybody who's worked on that. So I don't think there's anything else that I wanted to say, but I'm very happy to take questions. Thank you.
Okay, thank you, Julie. Tina?
Not a question, Chair, just wanted to point out the education training plan being approved. There was a huge amount of work undertaken by the organisations and health board, and to have that record amount of 260 million contributing to the workforce, I think is really superb. And from the Education Committee's point of view, I know how much work went into that. So I just really feel that that is a really significant achievement. Thanks.
Thanks, Tina. Ruth?
Thank you, Chair. It's just a general question, really. You talked about, you know, the rumbling on of COVID and Omicron and having to extend our arrangements. I just wondered whether we've got any feel for general morale of staff and well-being and how people are holding up across HEIW. It's been a long time and lots of you know, periods when we've sort of looked forward and then got let down and had to start again.
Yeah, thank you, Ruth. That's a really good point, actually. So I think generally the morale of our staff is positive. So we have extensive arrangements through local teams and through directorates to make sure that we keep in touch with individuals. We have got fortnightly staff fora, which we regularly have about 140, 150 people attending, which is almost 50% of the workforce. So that's a really positive thing. We had a Christmas staff training event, which was a blend of sort of social activity and actually learning, and that was really joyous, and people seem to be having a good time whilst coming together to sort of hear about the latest developments. So it does feel good. We've got the building open for...
Julie?
Yeah.
Important to say that that was held on Teams?
Yes, it was. Sorry, yes. Yes, it was, Chris. Yeah. It was a virtual event, yes. So yes, it was a virtual event. We also have the building open for wellbeing, so that's been a constant. Although we closed in March 2020 for 8 weeks, I think it was. Since then, we have allowed staff to come in for wellbeing, as we've had a steady trickle of staff using the building for that purpose. So we've got all the mechanisms in place. I think morale feels quite good. What we are really cognizant of is actually that perhaps our communication from a business perspective is becoming a bit siloed. So that's why as an exec team, we're really keen to get staff back in as soon as it's safe to do so. And you might recall that last autumn, we talked about a blended agile working model of 3 days in the office and 2 days at home. And that's what we're looking to go to in 6 weeks, as long as it's safe to do so and the government rules haven't changed again. So we're working really closely with the unions and with the staff to do the transition for that arrangement. So I think we're okay. Morale seems all right. We're still recruiting people. The joiners are telling us it's a great organisation to work for, even though they've never actually been in the building. So it feels okay at the moment, but we are keen to get people back into work face to face.
Well done, because it's a tribute to the leaders, really, and it's not been easy. Thank you.
Thank you, Ruth. Thanks.
John?
Thanks, Chris. Julie, in the context of the mental health strategy, it's a slightly related point, but the Minister for Education and Deputy Minister for Mental Health have been running a task and finish group on the whole school approach and the emotional well-being of children. And I know that they've decided to uplift that from a task and finish group to a ministerial oversight board looking at mental health services for children and young people. And I know also that HEIW is going to be asked to be a member of that. Have we heard anything about putting up a nominee, do you know?
We haven't heard anything yet. I'm reliably informed by my source. Yeah, we haven't heard anything as yet. Obviously, CAMS is part of the work that we've been doing, but that's a particular group we haven't had an invite as yet.
Okay. Any other questions or comments for Julie? Okay, thank you very much, Julie. In that case, I'm going to move us on to agenda item 3.1, update on the development of the IMTP. Nicola, where are you?
Here, Chair, thank you. Thank you, Chair. We've been developing the plan with the board since September, when the board approved our strategic framework for the plan, and in November the board received a report on our progress on our active planning and the development and shaping of our strategic objectives and plans to deliver those. And again, we discussed the detail of that in December, as well as the themes of our engagement with the NHS. As a result of all that work, we do have a very strong set of strategic objectives for 22 to 25, as has been referred to a few times in the meeting already, through which we will drive to deliver the strategic change that we laid out in the workforce strategy, and to support all NHS organisations who are engaged in their own strategic service change, and also to support the recovery agenda, which again we've already talked about, which is extremely important as we come out of the pandemic. A working draft of the plan, which outlines all of our work to date, has been shared with board members to support this discussion informally by email. And we're happy to take any comments by email still up to the end of tomorrow or into next week as members require. The remaining work to prepare the final draft, which will come to the board in February at the BDS, and we'll discuss it there. And then the final plan, which will come to the board in March, is to respond to our, we're undertaking our wider stakeholder engagement over next week through our new stakeholder reference group and a meeting with the Welsh Government policy leads. And obviously we'll respond to that in the next draft. And also there's more work going on the financial plan, which the extension of the submission deadline has meant that we can bring more work on that to discuss with the board in February as well. In terms of approval for submission, we're now working to the extended deadline of the 31st of March, and the final plan will come to the board at the March meeting for approval to submit to Welsh Government, and we are on track to submit an approvable IMTP in line with our statutory duty. So I'm going to hand to Rhiannon for a bit more comment on the financial plan, and then Chair, happy to open it for any comments, questions and discussion.
Thank you. So just to say that we developed the financial plan as described in the updates previously, but without sight of the Welsh Government allocation that we'll receive for 22-23. So the extra time that we've been afforded will allow us a review of the allocation that we're expecting at the end of January, and I suppose consideration of how that funding is deployed across the organisation to best effect to achieve objectives. It'll give us an opportunity as well to consider the non-recurrent items that we'll be discussing with Welsh Government Finance through the year, but also any schemes that we need to do a little bit more in terms of being able to get them over the line and secure funding for those. Thank you. Okay,
thank you, Rhiannon. Nicola, just for the independent members' point of view, this is going to come to our board development session in February. Do you want submissions or any issues raised before that from the independent members in writing?
We have shared it informally with the board, obviously through the BDS. We are happy to take any submissions from members at any time until the finalisation of the plan in mid-March, actually.
Okay.
So happy to receive those.
Okay, fine. Any comments or questions from members? Jill?
Yeah, thank you, Chair, and thanks, Nicola. A huge amount of work has gone into this, and it looks really good. I think it's developing nicely. Thanks for commenting, Rhiannon. That was one of my questions, was I guess weaving the financial strategy into it, and a question about, is it affordable? Can we do it all within the envelope would be one of my questions, I guess. And the second question is the movement. I understand the movement of the deadline, but does that give us any difficulty? There's not likely to be any change in strategic direction. It's just merely about giving people more time, is it? So, okay, so we might not get it signed off though, presumably until we've already started the year.
So the submission to Welsh Government is the 31st of March, so by its very nature, we won't get approval from Welsh Government until into the new year, but we will be doing our delivery planning on the assumption that the board will sign it off, and at the end it's our plan. Once the board has signed it off, we'll start to deliver it. And the extension was about the COVID response in health boards and trusts.
Yes, yeah.
It hasn't knocked us off track at all.
No, okay, thanks, Nicola. Thank you.
There's a very useful suggestion in the chat box, which is, can we identify any areas that require more discussion as we come to that board development session? So if Nicola could have some idea as to areas that need to be looked at in more detail by the 11th of February, then we can orchestrate a bit of focus on that at that meeting. Is that okay? We can have a more in-depth discussion if necessary on certain areas. The IMTP is quite a big beast, but it's really, really important that we understand it and that we actually deliver on it. It's the delivery end that's going to really count from here on in. And I'm really grateful to hear the progress, Nicola, and it's a bit fortuitous that we've got an extension. Bit of a pain that we won't hear until the middle of the year, but we must make every use of that extension. Jonathan.
Thank you, Chair. Can I just firstly echo Jill's point about the amount of work that's clearly gone into developing this. This is a mammoth task for any organisation, and it does require a unique set of skills to pull all of this together. In addition to that, it requires a unique set of skills to try and condense the understanding of the IMTP onto one page. I think you ought to share this widely across Wales, because there'll be organisations who I think would love to be able to do that, but that in itself requires a certain skill. It really is extremely helpful the way this has been pulled together. I suppose what strikes me with something of this size is the extent to which, and obviously I know this feeds into so much and all of what the organisation is seeking to achieve, but the context of how and where and the extent to which this is captured from a risk perspective, because clearly there are huge risks associated with things not going according to plan. I know this is accommodated very much in how we assess the potential risks as part of the corporate risk register, but clearly making sure that is continuously reflected on as we go through this to make sure that we identify particular risks of where things might not go according to plan and what mitigating factors we might need to consider. But I suppose it's just always having that in mind as well.
Okay, thank you, Jonathan. The other thing, Nick, just for, I think there's so much value in if we deliver all this to the situation that we find ourselves in as a country. I think we should be really mindful to voice that bit about the value of this and the component parts. And I think that's a bit of, that's not about bragging, that's actually about making sure we show the value for the investment. I think it is about showing the value for that investment going forward. It's going to be really important. Okay, so thank you, Nicola, for that. Do you need any, the board's asked to note the extension of the submission of the IMTP to Welsh Government to the 31st of March. And we flexed the board approval time to meet that, and to note the update on the development of the IMTP and finalising the plan on track to meet the revised deadline and submit for approval. So is there anything else you need from us, Nicola? No? Oh, Julie?
Yeah, thanks, Chairman. So I think it was just to sort of reiterate, if there's any comments that people have got or any areas that they're particularly interested in, if they could let us know that by the 11th of February, that would be incredibly helpful. And then, as we said, we will have a look at areas that we may want to highlight at the BDS session in February, just to sort of hone the discussions. But in particular, if there are things that individual independent members are particularly interested in, then it would be helpful to know those in advance. Thank you.
Okay. Thank you very much. Agenda item 3.2, establishment of the HEIW research governance framework. Where's Push?
Thank you, Chair.
Push.
Sorry?
Good morning.
Morning, how are you?
Good, yeah.
So I'll be fairly brief with this because this is something that we've been working on for a while, but has been through execs. We had some discussion that we were going to take this to the Education Committee, but execs felt that all the independent members should probably see this. So that's why it's here. So it says what it says. It's an establishment of functional infrastructure for the research governance across HEIW. We have, as a background, we have loads of activity that could be brought under the broadest sense of research within HEIW already. Previously, when we had the separate organisations in Cardiff University, in the Wales Deanery, and the equivalent of pharmacy, there's a fair amount of work going on in those areas that could have been brought under this umbrella. So one of the things that I felt when we started here was that we needed something similar, but something a bit more robust for HEIW to bring together all of the work that was previously done in our predecessor organisations, but also what's being done elsewhere within HEIW now. And that's one of the reasons that we've developed this. It's consistent with our strategic objectives and of our draft that aims in our draft IMTP. It fits in with our vision of leading the way through continuous learning, improvement, and innovation. It's a coordinated approach to research governance activity within HEIW, and as I say, it was approved at exec team recently, and it gives us organisational oversight for all of this work. We saw a publication in our first or second year from our sister body in Scotland, where they brought all of their activity together and actually published it in a document in 1 year. And we looked at it, we said, well, actually, we're doing all of this. And you know, we're not telling anybody what we're doing. So that was one of the other motivations for us to bring this together. One of the difficulties that happened when we left Cardiff, when those organisations left Cardiff University, is that they didn't have automatic access to the ethics committee, but that's been re-established, which is a key part of this. As I say, it's not confined to my directorate. It also involves colleagues from Lisa's directorate, Julie's directorate from the leadership side, and all of our directorates are all going to do some sort of evaluation or potentially research in their areas. So that's what this is all about. So the way we think that this is going to work is that anything that is vaguely thought to require our input will come to our research governance group. Many of them won't be research, and we'll feed that back. Many of them may or may not need ethics approval, and we'll feed that back or direct them to the ethics committee and assist them in that way. Many of them might need funding. You know, some of our evaluations of our big projects may need funding. When we have that requirement for funding, that's where execs will come in, because we may have a lot of requests for evaluation, but I think it needs exec oversight to decide which ones are our priorities. And that's the way it dovetails in with our exec team. So that's in front of you. That's the framework we've developed. We have already started it, but we're very happy to take any comments to see if we could work it better, or if there's any comments about our framework or our terms of reference itself. So thank you very much, Chair.
Thank you, Push. Can I ask, are there any questions from the board members, please? Tina?
Thanks, Chair. Thanks, Push. I think in relation to the paper, I don't have any issues with that. I just wondered whether or not the legislation under information governance, having sat on Welsh Information Governance Board for about 8 years, I just wonder whether or not we should actually update some of the references, because we talk about the Data Protection Act in the paper of 1998. There was an update on that Act in 2018, and maybe if we could look at that. And also the Health Service Act of 2012 in relation to information governance and research, which is still from a UK perspective, but just to pick out the particular roles that pertain to Wales, or to comment whether there are any specific issues to meet the governance, because I'm aware Wigsby changed recently. It's a new board, but I do think we need to comment on whether or not we're compliant with the more recent legislation. Thanks.
Thanks, Tina. Absolutely, and I'll take those issues back and we'll clarify them. We've got to get it right. So very, very helpful comments, Tina.
Ruth?
Thank you, Chair. I'm just so pleased to see this. That's very, very welcome. So thank you. Just a couple of comments. One is about a sense that I get from the paper that we're basically corralling things that are already going on, and that we don't have a sort of strategic intent about this. Is there a need for us to be a bit more proactive as well as receiving? Do we need to know what sort of research would be helpful to us and actually promote or commission that in some way? So where is the overarching strategy for this? And presumably, if we are going to support things and support staff, there is need for a budget. Is there any designated budget, or is this ad hoc and up to directors to decide what they think is best in their own directorate? And a final point, just we're talking about governance, and our governance in the description sort of stops for me at the research, at HEIW's new research governance group. Well, that's great having that, but it'd be useful to know about its upward accountability from there. You can get some quite tricky situations arising in a research context. I think the board needs to know where we sit in relation to that. And maybe that's through the exec committee, I don't know, but it's not specified very clearly to me in the paperwork. Also, as a rider to that, the Education Committee will continue to take an interest in this area, as we have done. And so where we fit, and we do, are mentioned in the text, but not in the diagrams, how that fits, I think we'd like to be a bit clearer about. So hugely welcome. Thank you so much. And we're glad to support it, but hope those comments are helpful.
Thank you, Ruth. I mean, the overarching strategy, we are developing something a bit wider than only this within the development of ERIC, evaluation research, innovation improvement collaborative. So we still haven't got to that point yet, but we felt that this was an important part of it that needed its own space. So watch the space, I think, is the way forward with that bit. Budget is interesting. We did have budgets for this in the predecessor organisations. They were linked with other organisations in Cardiff University, which we felt would not be correct for us to take forward, and because a lot of the evaluation work that we might want to commission can be done by lots of agencies, and we probably would go out to tender for many of them. So that's a work in progress as well as to how we develop the funding around this. I think it'll vary each year, because I think there may be big projects some years and not big projects the next years, and there may be the skills within our organisation to do some of the evaluation. So I think that's all to be determined as we move on. So it is a work in progress in that sense. So apologies for not making it clear what the governance arrangements are. The intention is that we'll have 3 monthly reports to exec team, and I would say that we will probably bring those same 3 monthly reports in the same way as we do some of the quality reports to exec team can come to education committee as well. And we'll make sure that the education committee is in the diagram somewhere.
Okay. Cheeky question, Push.
Yeah.
You may not want to answer it, but we've got colleague organisations called university health boards.
Yep.
To do that, you've got to be teaching, training, and researching.
Yep.
And from what I gather, we do teaching, training, some training and education, and some research. So my question is it possible for a special health authority to become a university special health authority?
So I think that's a tricky question, because I have given that some thought already. I think we probably do more than some other organisations who get university status, quite frankly. Having said that, we've got quite a close business relationship with universities. So it just makes me, I think we just have to make sure that none of that comes into play if or when we were to consider ourselves as a potential university organisation. That's the issue there. I've got no doubt that we would potentially have the ability to become a university organisation, but whether it's appropriate or not may come out of our further discussions.
That's a different question. Julie.
Yeah, I was just going to come in on that, as you would expect me to do, wouldn't you, really? So thanks for all the comments. I think they're really excellent. As execs, we've been super supportive of Push doing this work, but it is a start. It is something that's in our Imtp for next year, our draft plans as well. So I think, the comments that have been made are really helpful in helping us sort of shape where we go next and think about the capacity we need and the budget as well. I think as to university status, we have got a huge amount to do. So, that might be something to aspire to, but in the short term, I think probably a few other bits and pieces that we need to focus on first.
Okay, you've put me back in my box, Julie. Thank you. But
nicely, hopefully.
Yeah, in the nicest possible way. But what the point I'm making is, I think this is a really, really healthy thing to be doing as HEIW, to actually take the research elements very seriously I think the comments made by Tina and Ruth about making sure that the governance lines are right and that that we are compliant with the various acts that are extant today. I think that's a really important thing to get right. So I'm gonna, if there are there any other questions or comments from board members? In that case, you're asking us to endorse the research plan.
Yes, please. Subject to the comments that have been made.
Subject to the comments that have been made. Okay. Can I ask the board members if they're happy to endorse this? If you can verbalise yes, please.
Yes.
Yes.
Yeah.
Could I add then that what we will do is make some of those changes that have been suggested, and we can take that then to Education Committee.
Yeah. But are you happy with that, Ruth? Can't hear you, Bach. Yeah. Excellent. So Ruth and Tina, as members of that committee, will give it an oversight. Julie?
Yeah, sorry to be a pain, Chairman, but just to come back in on that, obviously this research function covers workforce and leadership and all of our functions. So I do think Education Committee got particular interest, but I was quite keen that it came to board because it is about the whole of our functions, not just the education bit.
And we're already seeing research that we're part of in the leadership arena in particular. And I would imagine with the work that's been done on the mental health workforce, that is going to be a real area of focus in the future.
Yes.
Okay, so thank you very much, everybody. We're now going to move into part 4. Rhiannon, where are you? We're going to move now into the report of the Director of Finance.
Thank you, Chair. So the report is as at month 9, which is up to the 31st of December, and it reports a financial position of 347,000 underspent. If I take you to the tables on page 3 and at the top of page 4, so we have an achievement of an income target of 75,000. This is largely because we recharge the costs of CPD events. They are still happening, but clearly there is no cost because it's online, so we're not able to recharge the cost of that. Pay an underspend of 558,000 due to vacancies, not all current vacancies that have happened through the year as a result of staff turnover, and creating new posts that we haven't yet filled. Non-pay expenditure, 712,000. So again, impacted by Omicron during December, and I guess our activity face-to-face that was curtailed as a result of that. The commissioning budgets are currently showing break-even in the Nursing Directorate. So we've described previously that we've run a process of bids for universities to put proposals to us for non-recurrent funding in years. So we are, I suppose, utilising underspend against those healthcare professional budgets in that way. For medical and pharmacy, we're currently reporting an overspend. So we have underspends on pharmacy budgets, the pharmacy programme, dental foundation training, and for the training grade allocations for junior doctors, but we have an overspend on GP training. As our programme of hand back to Welsh Government of funding is happening, we are, I suppose, taking funding out and returning it to them from these underspending areas, and that has exposed that overspend on GP training. Our dialogue with Welsh Government is continuing. They are supporting us and will, I suppose, accept another handback of funding before year end to enable us to achieve our break-even position. Just moving on to the capital expenditure. So we've spent 15,000 year to date, and there's another paper coming up that describes our plans to purchase IT equipment for another 82,000, which takes us very close to our discretionary capital allocation. The balance sheet is presented as at the 31st of December. There is an increase in our trade and other payables, and it's predominantly due to accruals with non-HS organisations, and that's related to our contracts with universities and the returns that we get for student numbers and for bursary. We have now largely received all of those, but we're undertaking the work to validate them to make sure that we only pay for appropriate charges. And that means that we've got a peak in our accruals because we've estimated some of those charges as at month 9. We also have an increase in our cash balance to 26.4 million at the end of the month. But we are obviously holding that cash to be able to discharge all of those liabilities in that creditor balance. And we have, I suppose, done a huge amount of chasing invoices across the NHS organisations and with universities. And we are really going to put in a concerted effort to bring those balances down before year end. The public sector payments policy, so we are achieving the target at 96.5% by number for non-HS invoices. For NHS invoices, we're at 85.98%. So there's a slight deterioration from the last report, but we've been through an agreement of balances exercise recently. So we have flushed out all of the, I guess, all of the invoicing and all of the charging that we will be due. So that puts us in a good position to make an effort now and before year end to be able to get that to a really good place. Thank you.
Thank you, Rhiannon. Any questions or comments, please, from board members? Jill?
And thank you, Rhiannon. It's very comprehensive papers. Going through the pay, I'm encouraged, I think, because of the underspend that we knew we would end up with inevitably, that we've been able to use some of that. So we're not giving it all back. So that's a really encouraging direction of travel. But the thing I took from this really, I guess, was our GP commissioning is quite overspent, obviously, as you've alluded to, and pharmacy underspent. So I guess the question that sort of begs from that is, have we got it right? Have we got the budgeting right? And secondly, I guess, in terms of our risk appetite, are we budgeting for ambition in terms of fill rates rather than the exact sort of facts and data? So I wonder if we're overestimating our ambition in some ways, and I guess that's a question going forward to make sure that we're not I mean, it's a good position to be in, obviously, but we don't want to constantly be handing back money. So I suppose the upshot of that is really, if we had filled the rates that we thought and got the training in place, would we have been in an overspend position, because our GP commissioning is incredibly overspent, and we might be in a much more difficult position. And I'm heartened that you're chasing the creditors, because I was a bit alarmed by 18 million in terms of the creditors. So I'm glad that that's coming down and that you've actually been able to chase and put in a system. It's been an ongoing issue, I think, of HEIW in terms of not getting invoices in a timely manner. So whether there's anything more we can do, I'm happy to discuss. So thank you, Chair.
Rhiannon?
Yeah, so I've just kind of come back on a couple of your points. So we have done a lot of work around GP training and taken sort of a deep dive exercise approach to it. For GP training, it's not about numbers necessarily. It's because trainees are taking longer to progress through the system and then leave. And as a result of that, they're moving up salary scales during that time. So there is certainly something about changing our modelling approach to be able to get the resourcing for GP training right. I think on some of our other programmes, all of our financial figures and planning is based on a set of assumptions. We have more evidence that we've collated over 3 years to be able to get those closer to, I suppose, reality, but we don't want to plan to fail either. So we don't want to, I suppose, not plan for 100% recruitment. And certainly the numbers in the pharmacy programs we're anticipating will get to the level that we are funded for over the next sort of 2 years.
John, and then Push.
Thanks, Rhiannon, on a very comprehensive report. My comment question is about the capital paper. I know it's an appendix, but I may as well take that. I was pleased to see that we'll be spending all our capital allocation this year, because I know there's always a risk, isn't there? If you don't spend it, you lose it. But I've read somewhere that there may be a shortage of capital next year. Are we likely to suffer in that, or would you think, as a small organisation in capital terms, we're likely to sustain that 100,000? What's your view on that?
So we have had correspondence to say that our discretionary capital will be reduced in line with everybody else's. So there's a 24% reduction, which takes us down to 76,000. It is something that I think, we probably need to do some work internally, because we'll have a replacement programme for the IT equipment, and I know Sean will be concerned with that. And we are coming up to the point potentially where we will need to replace a lot of things because we had them all new at the same time.
Yeah.
But it is something that I suppose we need to have a conversation with Welsh Government about what capital allocation is right for us. Because I think the 100,000 discretionary capital was a bit of a start point until we'd done that work to, I suppose, go back to them with what we feel should be the correct level.
Yes, because as a small user, I mean, a 24% reduction is huge, isn't it?
Yeah. Yeah.
Oh, yeah. Okay, we'll have to keep an eye on that then.
Yes.
Push. I can't hear you.
I noticed that Alex has just commented on one of the things I was going to say, and that is that we're doing some work on the GP issue to bring back to a later meeting, because it is quite complicated. On the one hand, we encourage people to do less than full-time training and give people all the flexibility to do their training. And then on the other hand, it then lengthens their training, puts them up increments. They're off for periods of time, which also lengthens their training program, which also puts them up increments. And by encouraging, all of these things have an impact. And the other thing is that by encouraging GPs and some of the incentives built into GP recruitment, a lot of people have left hospital posts to take up GP training, and they have protected salaries which transfer across to the GP training program. So it's quite complicated, and we're trying to get our heads around the whole of this to bring back to execs in the and other boards later. The pharmacy thing, I think, is we're victims of a national issue here, where pharmacy recruitment or pharmacy enrollment into university courses has gone down considerably. The reasons are complicated, but that's happened across the whole of the UK. And I know that for the first time a couple of years ago, the School of Pharmacy in Cardiff went through clearing for the first time in a long, long time. So the knock-on effects of this is that that there's fewer people looking for pharmacy careers. And I think that's part and parcel of what we've been seeing. Having said that, we are still recruiting as a country a higher percentage of our posts than anybody else in the UK. So whilst the numbers aren't what we would like them to be, we do see that we're probably the best place to come because of the offering that we have. And I do think that they will increase as time moves on.
Thanks, Push. I've got Sean and then Lisa.
Thank you. Yeah, I just agreeing with Rhiannon on her point on capital, and we'll work together on that for next year's refresh. But I wanted to just draw attention really to our digital strategy and our model, we are in the process of migrating all of our infrastructure to the cloud, which actually means we will be in a revenue model, not a capital model. And that's quite an envious position of many organisations who are finding that transition really hard, but it will give us a different advantage moving into next financial year as we understand that and how it impacts on our finance position. And it's the direction of travel really, and in line with Welsh Government policy that we should be a cloud first. It does change the traditional financial planning of how you do IT. So we're working really closely to offset that difference in capital with a revenue model. So that plans on conversations are ongoing.
Thank you, Sian. Lisa?
And picking up actually on what Rhiannon said about assumptions, yes, it is quite clear we will be actually looking at those assumptions going forward. And one aspect actually that we will be looking at as a nursing directorate is actually the uptake of the bursary versus actually people who are self-funders. And we're actually doing a bit of a look back to see what that trend is. Dare I say actually that at the moment actually the number of people actually taking up the bursary is reducing. And as a consequence, obviously that's impacting on our financial position as well. But obviously we're going to do an in-depth review of that to see what that is coming up. And obviously the bursary programme itself is actually going to be subject to review actually by Welsh Government as well. So that's another area that we are going to be looking at. Okay,
thanks, Lisa. Can I make ask a question? I probably not got this straight in my head. On our risk register, corporate risk register, is cyber security. Is there a capital element that's needed to ensure that we mitigate the risks of cyber attack?
That plan, as we migrate to the Azure, the cloud platform, we are significantly improving our cyber response and our ability, and that being hosted in the cloud is a revenue model, not a capital model. So that is a much more promising. So we're not changing servers physically on premise, we're actually deploying that in the cloud, and it's all linked to revenue.
Right, thanks, Sian. I just one of the things I was thinking was if the capital is going down, then we need to be able to secure a cyber security as far as we can.
Yeah, kit laptop is still a capital model, but our infrastructure is moving to the cloud and is going to be a revenue model moving quite increasingly.
Thank you. Right, are there any other questions or comments to make to Rhiannon about the finance report? In that case, I'm asking the board to note the underspent financial position reported for HEIW at month 9 and actions being progressed to be in balance at the end of the year. So I'll ask you to note that, please. Yeah, thank you. Note the summarised explanation of key variants by directorate.
Yeah.
And note the capital allocation and spend to date and the balance sheet position.
Yes.
Yes.
Yeah. Thank you very much. Thank you, Rhiannon. That's your first one as the interim director of finance. On 4.2, we've got the anticipated future capital spend. So is that do you want to speak to that separately, or have we covered that?
It's just if anybody's got any questions. I think there are plans to I suppose buy more IT equipment to get to 97,000, I think it is, with a small balance left for anything that we will need to do sort of before the 31st of March. But that means that we've broadly balanced the capital allocation.
Yeah. Are we kitted up enough to do video editing and video filming?
We do have those resources, and just to back off from Rhiannon's point, that kit's already, most of it has been re-delivered. So the team have been in receiving goods already. So there's good progress in relation to that 82,000.
Okay. All right. Are there any questions on this for Rhiannon and the guys? No? Okay. So we've been asked to note this report. Thank you. Our next agenda item 4.3 is to receive the key issue reports from Education Commissioning Quality Committee held on the 18th of January.
Thank you, Chair. This is a verbal report because I don't believe the committee has yet had the written report, although it is available and will be circulated with detail shortly. So I'll just touch on the highlights. The committee met, as you mentioned, on the 18th of January, and we were very pleased that you could join us on that day. And we started and spent quite some time on our quality assurance updates this time across the health care disciplines, across medicine, dentistry, pharmacy, nursing, and the allied health professions. And we received the reports in a new format based on the quality framework, which was the first time we've done this, and it was extremely useful. First time we were able to have a set template, and so we hope to be developing that and as time goes by. On the medical deanery quality assurance activity, there was nothing particular to note. However, we also had a report on the General Medical Council National Training Surveys for 2021, and the response rate for Wales is actually significantly higher in here than in the UK as a whole. And overall, trainees in Wales continue to report relatively high levels of training satisfaction. We noted a report on the dental deanery quality assurance activity, which confirmed the contract for the new North Wales dental training unit had been awarded, and that unit's due to open in September this year. We also received a General Dental Council Education Quality Assurance report, and although this was generally excellent, there were several areas which were pointed out as needing little more assurance, and those included, for example, the reporting of health and safety, and all those items are being addressed this quarter and are currently being dealt with. The pharmacy deanery quality assurance activity confirmed recruitment for 111 multi-sector places for 2022-23 was completed with 100% fill rate, and a new provider for pharmacy technician program been secured. Nursing and health professional education quality assurance activity, the Directorate had revised its report to reflect the quality of framework approach adopted by the other deaneries, and it confirmed that 2 regional care home educator facilitators have been appointed to work with key stakeholders to expand sustainable healthcare student placement activity. And placement is a really key issue for us, both in this context and wider. And we will be spending some time, I'm sure, during the coming year returning to that issue. 3 courses had been identified as needing enhanced performance monitoring, and the necessary action we were assured was in place. We had a report on improvements to the University of South Wales midwifery education programme. This was an opportunity to look at the processes that HEIW has developed to respond to issues raised by students in engagement events, and those systems seem to be working well in partnership with the university provider, and the committee noted the steps taken. Education commissioning plan process for 2023-24 has started, and we were given a heads up that is now underway, and look forward to hearing more, building on lessons learned from last year. We had a verbal update on quality and diversity, particularly in relation to differential attainment and our refugee programme. we also had a discussion about how we could most usefully use this regular item on equality and diversity to add value and to gain assurance that we are doing all we can in that area. And finally, we had an update on phase 2 of the strategic review of the commissioning of health professional education. And we noted new governance arrangements that have been brought in to oversee this second phase, which is involving multiple moving parts, really, and is a complex and in some ways a challenging area. We noted the actions being taken and were assured that things were moving forward positively. And we particularly noted the progress on developing the healthcare support worker programme and the recommendation that it go out to tender. I think we will be returning to that item perhaps later. That is a very quick run through our meeting on the 18th of January. But if people wish to raise points when they've read the written report, be very glad to respond to them. Thank you.
Thank you, Ruth. Are there any questions or comments following that report? No? Okay. It was a really interesting meeting, Ruth. I really enjoyed the quality safety discussion that we had. I thought that was very important.
Yeah. Well, you're welcome anytime, Jen.
Yeah, well, thank you. So I'm asking you to note that verbal update. Jill, have you anything from audit and assurance?
No, there hasn't been a meeting. That's next week.
Right, okay. In which case, I'll move us on to the next agenda item 4.4, which is in-committee decisions. And they are there for you to note. And now go on to another item which I missed out earlier on. And it was in my chair's report. And it was...
sorry, Chris, before we move on to AOB, we've got the corporate risk register just to note.
Yeah, I was going to do that after this.
Oh, apologies.
Okay. So I need you to go back to my chair's report. And unfortunately, I took a chair's action, which is in my report, but I didn't ask you to ratify. And this is regarding a decision we made at the RATS committee. And it was about a recommendation, adoption of the recommendation contained within the Managing the Pay Implications of Multi-Professional Roles report, which we considered at the RATS committee on the 25th of November. And in accordance with HEIW standing orders, action was undertaken by the Chair and Chief Exec after consulting with independent members. So I'm asking you to ratify the decision, please.
Yes.
Yes. Thank you so much. And agenda item 5.1 is the corporate risk register. I'm asking you all to look at it and to note it. Is there anything of particular note that's changed, David, that people should be highlighted?
Yes, so there are currently 10 risks on the register, 1 red, which seems to be cyber, 8 orange and 1 green. The green relates to the risks associated or created by COVID and its impact on placements for students and for trainees. That's been downgraded in the last month as it's deemed to be a risk that's actually occurred, and it's now deemed to be business as usual. And there is 1 new risk relating to the postponement of the procurement process around the Bwrdd solution,
okay,
and the associated risk to the Imtp. That is now assessed as an amber risk.
Thank you very much. So can I ask you all to note that risk register, please?
Yes.
Yes.
Thank you. Now we come to any other business. So I thought it would be a good opportunity to ask John if he wanted to make some comments, as this is his last meeting. So John, the floor is yours.
Oh, thank you, Chris. What an honour. I was just going to say a few words. It was always part of my plan that when I reached a certain big birthday, I would retire from the NHS. And I did indeed reach that big birthday last year. So I'm sure you'll be very pleased for me when I tell you that I've sent off for membership of Glamorgan Cricket Club. Looking forward to that coming in the next few weeks. But when I think back, some colleagues here will remember 4 years ago when we all met in the old library in the Hayes. Do you remember those days? And we were in setup mode and we were establishing HEIW after the ministerial direction. And when I think of how far we've come in those 4 years, I really marvel. HEIW in those 4 years is now very firmly established. We built a strong reputation for delivery and improvement. And I know, because when I represent you at the Vice Chair's meetings for Wales, I know the high esteem in which HEIW is held in nationally. And that's due to Alex and the executive colleagues and indeed to all the staff who've worked so hard in those 4 years to set up this wonderful organization. So I congratulate you all for the work that you've done. It's been a privilege, as I said in my report, to be a member of HEIW board. And I thank you for your fellowship and your friendship over the last 4 years. And I extend to you my very best wishes for the future. And if I still get the emails, I will keep a close eye on how you're doing. So thank you very much indeed.
Thank you, John. Right. So the next board meeting is a development session on the 24th of February. Unless you hear otherwise, it'll be on Teams. And the next board meeting, open board meeting, will be held via Zoom or teleconference on the 31st of March. So thank you very much, everybody. I now make it 11:47. Can I resolve that we go into in-committee session at 12:15. Thank you very much, everybody. Hwyl nawr.